Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about Ortho Tri-Cyclen. Ortho Tri-Cyclen is an oral contraceptive, a birth control pill. It was originally approved in 1989. A low-dose version, Ortho Tri-Cyclen Low, approved in 1998. It's obviously for the prevention of pregnancy, but it also is approved specifically to treat moderate acne in women who are at least age 15, who've gone through puberty, who have acne, and who have a desire for some method of contraception. The medicine is available as a generic, as Tri-Mili, Tri-Sprintec, Trinessa, simply Tri. It combines an estrogen, ethinyl estradiol, and a progestin, in this case, Norgestimate. Oral contraceptives are one of the most widely prescribed pills in the world. Just in the United States and Western Europe, more than 100 million women are current users of these medicines. Unfortunately, there is suboptimal compliance, and because there's suboptimal compliance, the real-world effectiveness of the birth control pill is nowhere near as high or as good as it should be. Well, if we look at women who are using some kind of contraception, currently, if we look in the United States, about 25% of them opt for the oral contraceptive. If we go to Western Europe, it's about 50%. If we go to Africa, it's only about 7%. The likelihood of continuing the medicine, if you start the drug, well, at 1 year, it's about 70%. The dropout rate is about 20 to 30%. You're more likely to continue the medicine if you use a combination oral contraceptive, like Ortho Tri-Cyclen, than if you use one that contains only progestin. You take the pills for 28 days. There are 21 active pills, 7 inactive pills. You take the pill at the same time each day. Take it with or without food. If you take it with food, it might reduce the likelihood of nausea. Well, the pills contain the same amount of the estrogen. The Ortho Tri-Cyclen contains 35 micrograms. The Ortho Tri-Cyclen Low, 25 micrograms of ethinyl estradiol. The change, the difference, is in the progestin, in the Norgestimate. The first 7 days, they contain 180 micrograms. It's a white pill. The second 7 days is a light blue pill. It contains 215 micrograms of the Norgestimate. If we look at the third set of 7 days, it's a darker blue pill. It contains 250 micrograms of the Norgestimate, and the last 7 days, they're green pills. They don't contain any active ingredient. The same company, by the way, makes a monophasic pill. Instead of 3 different doses, makes a solid dose, so that with Ortho Cyclen, the monophasic pill, you have 21 days. Each day has the 35 micrograms of the ethinyl estradiol, the estrogen component, but these pills all have 250 micrograms of the progestin, the Norgestimate, and then you follow with the 7 inert pills. Now, there are some cautions and precautions about taking the birth control pill. You shouldn't smoke cigarettes and take the birth control pill, but then you shouldn't smoke cigarettes anyway. But if you smoke cigarettes, you can't take these pills after age 35 because it dramatically increases the likelihood that you're going to have some serious cardiovascular risk. If you begin the pills, you can begin the pills first day of your period, or you could begin them on the first Sunday after the start of your period. If you opt for the Sunday start, then you should use an additional method of contraception for the first 7 days. If you're changing from some other method, say you're using an injection or you have an IUD and you have an implant of some sort, and it's time for your next dose of that, well, you just start the birth control pill right then, right there. That's okay. If you've had an abortion and you were in your first trimester, you can start the pill right away. If, on the other hand, you delay for 5 days or more, then if you start the pill, you should use some additional method of contraception for the next 7 days. If you have a second trimester termination of the pregnancy, you should wait for about 4 weeks because of an increased risk of blood clotting if you were to take the birth control pill during the immediate after time. And you begin the pill either on the day of your period or on the Sunday and follow the same directions we talked about a moment ago. If you've had a baby and if you're not lactating, you should wait at least 4 weeks after the delivery until you take the pill. If you don't have any period during the postpartum phase, then you should consider whether you're pregnant or not. If you're taking the pill and you miss one pill during weeks 1, 2, or 3, you take that as soon as possible and you just continue taking the pills the way you're supposed to. If you miss 2 pills during weeks 1 and 2, you take the 2 missed pills right away and then you double up on the next dose, then you continue taking the pills and use extra method of contraception for the next 7 days. On the other hand, if you miss 2 active pills in week 3, or if you miss 3 or more pills during weeks 1, 2, or 3, you throw out the old package and you start a new pill the next day, or you start the following Sunday like we mentioned before. And you also should consider, if you're missing that many pills, whether the pill is the method that you should be using. Because remember, the likelihood of your becoming pregnant will increase if you continue to miss the pills. Now, contraindications are for likelihood of some sort of a vascular event, a blood clot, either in the vein or the artery. So increased incidence if you happen to be a smoker and you're over age 35, or if you have a history of deep vein thromboses or pulmonary emboli, or if you've had a stroke or had heart disease, coronary artery disease, you have valve disease that leads to atrial fibrillation, then don't take these pills. If you happen to have uncontrolled high blood pressure, again, it's not for you. If you have diabetes and you already have vascular disease, shouldn't take the pill. Diabetics who don't have vascular disease, it's okay. If you have a headache and you have focal neurologic symptoms, or you have a migraine with aura, shouldn't take the pill. You have liver disease, viral hepatitis, liver tumor, don't take the pills. If you have undiagnosed uterine bleeding, again, don't take the pills. They're not for women who are pregnant or who have an estrogen-responsive tumor. And you certainly should stop the pill right away if you have any loss of vision, double vision, problems with your vision. There is a risk of high blood pressure if you take these medicines. There's a small chance of increased incidence of gallbladder disease, especially in women who have pre-existing gallbladder disease, or women who, while they were pregnant, had a history of cholestasis, didn't have good flow of the bile. They can increase the blood sugar, decrease the glucose tolerance, and they may increase the triglycerides, and you should wait until at least your 3rd postpartum week to start taking the pill, because of an increase in the likelihood of blood clots that would occur were you to take the pill sooner. Some women develop some unscheduled bleeding or spotting when they start taking the pill, and that's especially common for the first 3 months, but that sort of rights itself after a few months, and that's no longer an issue. But if it continues, then you should see your obstetrician or gynecologist, because there might be some other issue at play. Side effects, well, they're not uncommon when women take the birth control pill, so headaches or migraines or abdominal pain, relatively common. Some women are going to complain of an increase or a decrease in the weight, vaginal infections, vaginal discharge, sometimes breast pain. Some are going to have moodiness, abnormal mood, or flatulence, or a rash, or discharge, or decreased libido. Sometimes nausea or vomiting, but you take it with food. Sometimes women, especially on exposure to the sun, can have some increased pigment on the skin, on the forehead, on the cheeks, on the nose. That's something called melasma or cloasma. And then some women taking the pills can become depressed. There's an issue about the incidence of breast cancer or cervical cancer. Probably both are slightly increased. How much, it's difficult to say, especially with the reduced amount of estrogen that's in the currently used birth control pills. When the higher doses were used previously, that was more of an issue, but now it's to a point that even in women who have the breast cancer gene, BRCA1 or 2, if they were to take the birth control pill at the current configuration, there's either only a slight increase or maybe even a slight decrease in the risk. Cervical cancer is slightly increased incidence. However, it gets back to normal after a period of time when you've discontinued the medicine. Well, if you happen to have hypothyroidism, it can alter the way the thyroid hormone is metabolized. You might have to take a little bit more medicine. Warning signs are something called ACHES. It's a mnemonic, ACHES. So A stands for abdominal pain severe, C for chest pain, coughing up blood, shortness of breath. H is for headache, severe dizziness, weakness, numbness. E is for eye problems, vision problems, blurry vision. And S is for severe leg or calf problems or speech impediment. Any of those, obviously, see your doctor. Changes certain kind of blood tests, changes the way certain other hormones are metabolized, especially the thyroid hormone, and can alter the glucose and can decrease the amount of folic acid in the system, which is a problem potentially if a woman then subsequently becomes pregnant. Well, consider folic acid supplements. There are contraceptive benefits of taking the birth control pill. So it helps acne, helps if a woman has excessive hair growth with hirsutism, helps in women who have heavy menstrual bleeding or premenstrual syndrome or premenstrual dysphoric disorder. Also helps a variety of other conditions, so it regulates the cycle, decreases the blood loss by up to 90%. So decreases the incidence of iron deficiency anemia or dysmenorrhea, decreases the number of functioning ovarian cysts, decreases the incidence of ectopic pregnancy and fibroadenomas and fibrocystic breast changes, decreases the likelihood of endometriosis by maybe 50%, decreases the incidence of ovarian cancer by 25%. Let me repeat that one because that's very important. Decreases the likelihood of ovarian cancer by 25%. Ovarian cancer is getting to be an extremely important disease, and unfortunately we don't have good methods for early detection. And here we have a method to reduce the likelihood of ovarian cancer by 25% simply by taking a birth control pill. That's good news, and it decreases the incidence of colorectal cancer by about 15%. So if you look overall at people who use the birth control pill, there's a reduced incidence of cancer, reduced incidence of cardiovascular disease, and a variety of other diseases as well. Well, the question is, what about the likelihood of death? If you happen to be a smoker and you take the birth control pill, the likelihood in a 40 to a 44-year-old woman of your having some sort of problem that would lead to death, taking the birth control pill, would be about 117 in 100,000 women. If you're a non-smoker, that number would be about 32 in 100,000, and if you're not using any method of contraception, it's still about 28, 30 per 100,000. So you can see that, at least if we're talking about statistics, yes, the women who smoke are more at risk, but just taking the birth control pill if you're a non-smoker doesn't really significantly alter your risk all that much. Well, does it cause birth defects if you're taking the pill and then you stop and then you get pregnant? No. Does it cause a problem with nursing? The answer is really no. However, if you start taking it relatively soon, it might impede the production of milk. Once the milk is being produced, probably doesn't have all that much to do with it. Probably is not an issue. If we look at pediatric use, obviously it's not meant for girls who have not yet had their periods, but it can be used in women who are less than 18 years of age if it's appropriate. Renal impairment, not studied. Liver impairment, shouldn't take it if your liver isn't functioning properly. If you have some sort of issue, then just stay off of the pill. You could overdose on the pill, but if you overdose on the pill, chances are it's just going to be some withdrawal bleeding or some nausea. The birth control pill metabolism may be impacted by taking other kind of medicines. So if you happen to be taking St. John's wort or Tegretol or Topramate or phenobarbital or Dilantin, then the amount of birth control pill in your system is going to be reduced. So the birth control pill will not function as effectively if you're taking those other kind of medicines. And if you take birth control pill, it's going to decrease the amount of Lamictal in your system if you have a seizure, or if you're taking a sleeping pill like Restoril, or if you're taking morphine, all going to be reduced simply because you're taking the birth control pill. The way the pill works is it inhibits ovulation. It also works other ways too. So it alters the cervical mucus so the sperm can't penetrate. It changes the endometrium, so it's less likely for implantation, and it changes the way the male hormone acts in the system. The Norgestimate is rapidly metabolized, first-pass metabolism, to some other female hormones, to some other types of progestin. Those changes occur in the liver and in the intestine. The pregnancy rate, if we look at women in general, women who are fertile, women who are having sexual relations and doing nothing to prevent pregnancy, is about 85 in 100 women per year. If women use a condom or a diaphragm or withdrawal or a spermicide or have no sex during their fertile time, the likelihood of pregnancy is about 10 to 30 per 100 women. The effectiveness of a birth control pill or an IUD or Depo-Provera or a Norplant or sterilization, fewer than 1 woman per 100 will become pregnant. Now, that's with ideal use of the birth control pill, but unfortunately, people have a tendency to forget to take the pill. And if you forget to take the pill, then the pill doesn't work so well. So about 60% of women don't take the pill regularly, and the likelihood of taking the pill regularly in women less than age 21 is significantly worse than it is in women who are somewhat older. So the effectiveness, well, it reduces the likelihood of pregnancy by probably only about 90%. So there are some key changes that have occurred over time with birth control pills. Reduce the amount of estrogen from 50 micrograms to 35 micrograms now to as low as 25 micrograms. We've changed the pills from monophasic to triphasic, but actually there's no specific advantage of taking a triphasic pill over a monophasic pill. Pills perform exactly the same kind of function. We have some new progestins. The original progestins all were derived from testosterone, so they can have some male activity, male hormone-like activity. So now some of the new ones are made from spironolactone, a completely different kind of medicine. In the United States, the tendency is to use the triphasic pills. In Europe, the tendency is to use the monophasic pills. There are more than 80 different kinds of pills to choose from. Now there's a tendency to use the continuous cycle, so you throw away the inert pill so you don't have any bleeding, and that's quite okay. That doesn't cause any kind of problem. It used to be thought that women needed to be checked before they started the pills, but you really don't need a pap smear. You don't need a pelvic exam, especially if you're a teenager. You should have your blood pressure checked, and you should have somebody discuss the history of blood clots and caution you against cigarette smoking. And the future. What does the future hold? The future holds these pills, especially the progestin-only pills, will be available within the next several years over the counter without prescription necessary. Maybe with counseling from the pharmacist, maybe not, but the American Academy of Family Practitioners, American College of Obstetricians, Gynecologists already signed on, and the application was submitted in 2016 to get these available over the counter. It usually takes 3 to 4 years, so sometime in late 2019, 2020, chances are we're going to have some availability of these medicines without the need for you to go and see a doctor. Well, how much do they cost? If you're paying out of pocket, paying cash, somewhere less than $40. If you have a coupon that you can get at GoodRx or any of the places like that, somewhere between $9 and $15 a month. So all of the pills perform the same function. They all are variations on a common theme. Ultimately, some of them are going to be over the counter. Your reason or your purpose is to decide whether you want to take the monophasic or the triphasic pills, whether you want to take the continuous pill or the cyclic pill, whether you want to take the combination pill or the progestin-only pill. But the one important thing, the real important thing, is whatever you do, if you decide you want to take an oral contraceptive, you have to remember to take the thing regularly. If you don't take it regularly, if you're even 12 hours off, you might get pregnant. So if you take the pills, take them and take them regularly. Anyway, thanks for watching. I'm Dr. Ken Landau.